Haven't you sweat enough? Haven't you postponed the starting on Monday diets enough? Haven't you complained to everyone about everything enough? Time to make a change. Time to take control of your life. Time to acquire the body of your dreams. Time to seriously consider cosmetic surgery. Safe, fast, low cost, and scar-free. Now, with better equipment and new technology, the beautiful sculpted body you desire is a surgery away. Dr. Kapositas. Time to make your dream come true. Cosmetic surgery is widely popular and performed all over the world. In Greece, we are seeing an increased amount of not only the Greek citizens, but also the national foreigners who are willing to undertake the procedure right here in the country. We're here today with George Kapositas, the marketing director of the Kapositas practice, and we will discuss with him the uniqueness of the practice itself, as well as his personal views when it comes to the surgery, cosmetic surgery, tourism, and all the effects of it. George, tell us a little bit about the practice.
Plastic surgery, plastic or cosmetic surgery at Kapositas Clinic is performed by my brother, Dr. Nodos Kapositas, a qualified surgeon since 1998. Who's gone through an extensive training program of study and experience in Greece, in the UK, as well as in the US. We've set up the business in 1998. In the year 2002, we decided to launch into the health tourism market, specifically for the cosmetic surgery business. And he is an active member of the American Society of Plastic Surgeons, the International Society of Plastic Surgeons, and also the Greek Society of Cosmetic Surgeons.
What the practice offers to the patients?
We have been able to offer very, very competitive programs for our patients, particularly the overseas patients, including the cost of the surgeon, the hospital fees, as well as travel accommodation for a number of reasons. Firstly, we run a family business, and this is very, very important to us because our main objective is to be able to offer a very personalized service to our patients. Secondly, we control the marketing cost. So what I'm trying to say is that we run a very, very tight ship. And finally, due to the volume of our business, we have been able to negotiate very good terms, but without jeopardizing the quality of the standards, the health standards with the hospitals we work with.
Now, in case a patient actually decides to work with you and have the operation right there, would you like to run the whole process with us?
We have simplified the process to make it easier and readily available to our patients. Initially, any possible candidate will make an inquiry to us, either via an email or perhaps with via the telephone. In the main, patients will ask about the cost, which is the main driver, deciding whether to undergo the surgery or not. If the candidate is happy with all the information received, then the next step will be to provide us with some photos of the area that we want to have the operation, as well as a full medical history form. It's very, very important for us to make sure that we select the right candidates for two reasons: for safety, and number two, because we believe that we would like to be able to offer the best possible and optimum result for our patients.
When the patient does arrive at the airport, run us a little bit about the process itself. Who picks the patients up? Where do they go? What happens with the transportation?
On arrival, the patient will be picked up by a private driver, will be driven to their hotel, either the one we arranged or through maybe their own choice. We'll check in, and in most cases they'll have a consultation straight afterwards. During the consultation process, my brother will explain all the pros and cons of surgery. We'll make sure the candidate is happy, and then we'll decide whether we want to proceed with the surgery or not.
Estamos salvos e estamos vivos. Agora.
What happens if a patient decides not to go through the process, the surgery itself?
If the patient does not want to go through the process for one reason or another, then there will be no financial charge, and the candidate will be quite happy to return to the hotel and fly back home.
That sounds good. How about the day of the surgery? What happens then?
The day of the surgery, a patient will be picked up again from the hotel, will be driven to the hospital to undergo all the pre-operative tests, which is very important. And again, if everything is satisfactory, then we'll undergo the surgery on the same day. Depending upon the surgery, the patient will have to stay overnight, either 1 or 2 nights, depending upon the surgery, and then after a couple of days will be discharged to go back to the hotel. It's very important to stay to Athens for a number of days, just to make sure there's no any complications. And again, depending upon the operation, perhaps after 7 or 10 days, our patient will be quite happy to fly back home.
When they do return safely home, do you suggest they keep in touch with the doctor?
Absolutely, yeah. I want to make sure that our patients are very, very happy, obviously to give us some feedback about the overall experience, how they feel, how they found the service.
And I guess if they are so very happy with it, they may book another surgery?
Well, hopefully, why not?
Thank you so much.
You're welcome.
We are here today with Dr. Kapositas, one of the most outstanding plastic surgeons in Greece. He has been in practice since 1998 and has worked in various hospitals all over Greece, as well as at North Creek in London and at the University of Illinois right in the United States. Dr. Kapositas, first of all, welcome. Thank you for coming.
Thank you, Sylvia.
Tell us a little bit about your overseas patients.
I have been treating overseas patients since 2002, mainly from UK and quite a few cases from United States and the rest of Europe.
What's the screening process?
My screening process is quite tight. The patients, needs to fill a meticulous, a detailed medical history form, and I evaluate my cases very, very tight in order to achieve optimum results and to have a very low to zero complication rate.
Sounds great. Now, Dr. Kapositas, I'd love to know what's the most popular operation?
The most popular operation from patients from abroad is the breast augmentation surgery. And on the other hand, liposuction is the second operation, and tummy tuck as well. And some people want to know if they are able to combine operation like breast augmentation, tummy tuck, or tummy tuck and liposuction, or facelift and breast augmentation, and so on.
And what is your priorities as a doctor?
My priority for every patient, especially from people traveling from abroad, is the safety of my patients and the optimum result, and the complication rate to be zero. And we have already achieved this. Since 2002, we have zero complication rate.
Thank you so much for being here.
You're very welcome.
When thinking of undergoing cosmetic surgery, the best choice is Dr. Kapositas. Let Dr. Kapositas' practice be the place where your dream comes true. Let the Dr. Kapositas make your cosmetic surgery an experience to remember.